So today we are discussing the implantable hearing device. So implantable hearing aid is divided as middle ear implant and then bone conduction implant. Middle ear implant is passive then active, and it is also passive active. So coming to the active middle ear implant, AMEI work on a direct drive principle. Direct drive principle. So they utilize hearing technology that drives ossicular chain uh, bypassing the ear canal, that drives ossicular chain bypassing the ear canal and tympanic membrane. So what is vibroplasty? So we'll discuss what is vibroplasty. It's a treatment of hearing loss via vibratory stimulation in middle ear with varied stimulation path ranging from ossicles to the direct placement of middle ear implant transducer over the round window. Type A vibroplasty, AMI, active middle ear implant or ossicular chain. Type B, coupled to remnant of ossicular chain, mostly step is a foot plate. Okay. Type C, vibroplastic coupling with round window. Remember this round window. Initially, type A is of ossicular chain coupling with ossicular chain. Then type B is on remnant of ossicular chain. That is step is a or foot plate. Type C with round window. Type D with inner ear fluid. So remember this. So coming to indication, when this middle ear implant is given, moderate to severe sensorineural hearing loss, CHL1, there is loss of consciousness or failed implantoplasty. So indication of what we are seeing here, indications for middle ear implant, mixed hearing loss and otosclerosis. Patient experiences difficulty with the conventional hearing aid. So what is the component? External component: microphone, amplifier, internal is receiver, conducting link or transducer. So floating mass transducer. You can see that. So this is floating mass transducer. You can well see that. So types of devices based on transducer device, the piezoelectric device, electromagnetic device. It is based on the classification based on the physics which is used to transmit the sound. So piezoelectric sound to microphone to processor and amplifier to electrical signals to piezoelectric devices causing vibrations. So piezoelectric means to change the frequency there is a motion. So example of piezoelectric device is Envoy, Ryan, or Taika. Electromagnetic device. Electromagnetic device, signal processor and amplifier, electromagnetic transducer, electromagnetic field setup cause vibrations of the ferromagnetic material, ferromagnetic unit coupled to ossicles. Example, vibrant sound bridge. So total versus partially implantable device. Partially implantable device, what is this? It has external microphone and speech processor that is connected to a transmitter with external coil that transmit electrical energy transcutaneously to internal device. Example, vibrant sound bridge is a semi implantable hearing aid. Middle ear implant approved by FDA, manufactured by Medal. So remember this Medal. It can be asked in DNB exam. Other example, Cochlear Met, Autotronics, Maxim Cochlear, Kodak's, Ryan devices. So you have this no, we have discussed. So these are made up of two components: internal, external. Internal is warp. So warp is, you can draw this diagram in the exam. Vibrating ossicular prosthesis implants. This is conductor link. This is floating mass transducer, FMT in short, audio processor. So the internal is warp, consists of receiver, FMT, floating mass plate, and conducting link. So you can see here now. This is floating mass link. This is conductor link. This is receiver. Or audio processor externally one receiver. So what is codecs? This is direct acoustic cochlear implant. You can see this photograph. You can see this photograph. So this is fixation system, this actuator. This is implantable case with RF coil. So consists of electromagnetic transducer, transfer acoustic energy directly to inner ear via the conventional stepes processes. So what is fully implantable? All components are fully implanted. Example, Cochlear, Carina, Envoy, Esteem, Impacts, Taika. Esteem device is piezoelectric sensor. Remember this piezoelectric sensor placed on the incus body serves as a microphone and driver cemented to the stapes. Implantation required disarticulations of the ossicular chains. So you can see this. So what is passive middle ear implant? No amplifications of incoming sound done during tympanoplasty. Example, PORP. These are PORP and TOR. Example. So bone conduction hearing device classification. If bone conduction hearing is classified as percutaneous and transcutaneous. What do you mean by percutaneous? What device is in direct contact with the skull? This is percutaneous. Transcutaneous with skin and soft tissue is interposed. Percutaneous when device is in direct contact with the skull. Transcutaneous with skin and soft tissue is interposed. So what is the clinical indication? Clinical indication of this bone conduction implants. So conductive and mixed hair losses. So congenital oral atresia, chronic ear discharge. So this is very important exams. Uh, uh, this is asked in exams. So conductive and mixed hearing loss, congenital oral atresia, chronic ear discharge, inability to wear hearing aid following radical, inability to wear hearing aid following radical method surgery. So you will remember congenital oral atresia, congenital hearing aid, inability to wear hearing aid following radical method surgery, unilateral mixed hearing loss, single-sided deafness, unsuitable ear canal for conventional hearing aid, audiological findings. So bone conduction, pure audiometry over 0.5, 1, 2, 3 should be less than 55 decibel. Average ear bone gap more than 30 decibel. So coming to the percutaneous bone conduction aid, implant protrudes out of the skin. Implant protrude out of the skin, high risk of granulations and peri-implant infections. Processor can't be loaded until osseointegration. This is very well. Example, Baha Connect. Okay. So Baha Connect. This is important. This is asked in exams. So give importance to this. It consists of titanium implant percutaneous abutment. Percutaneous abutment. So let's revise once. Which is touching the skull, whereas transcutaneous is when skin and soft tissue is interposed. So you'll remember this. So it consists of titanium implant, percutaneous abutment, and sound processor. Two-stage procedure. Titanium is to live for 3 months for osseointegration, abutment, and again 3-month wait. Baha in adult, one stage screw plus abutment for 3 months. Apply aid, MRI compatibility, no issue. So what is transcutaneous device? Implant lies completely under skin. So transcutaneous device, implant lies completely under the skin. Implant site closes and heals completely, transmit signal with induction loop system. Example, Sophona, Bahar track, bone bridge. इसके बाद देखिए सोफोना एंड बाहर ट्रैक अवेलेबल फॉर चिल्ड्रन एंड एडल्ट्स सोफोना एंड बाहर ट्रैक डिपेंड ऑन फिक्सेशन ऑफ इंटरनल मैग्नेट टू द स्कल सोफोना एमआरआई compatibility MRI conditional up to 3 Tesla and magnet grade 5 centimeters zero artifact effect. So what is bone bridge? Sorry, what is bone bridge? So it is active semi-implantable internal device. It consists of external audio processors and internal bone conduction implant. Internal component has receiver coil, processor, and active transducer. So classification of cutaneous complication of transcutaneous abutment in Baha. So grade 0, no skin reaction. Grade 1, redness with slight swelling. Grade 2 is, so grade 1 is this, you can see this, redness with slight swelling. Grade 2 is redness, moistness, and moderate swelling. This is moistness, moderate swelling. So grade 3 is redness, moistness, moderate swelling is tissue granulation. Here granulation are being formed. Grade 4 is profound sinus infection requiring implantation. So, okay. So complication of bone conduction implant. This is important. Intraoperative bleeding. It can be dural injury and CSF leak. CSF leak during operations. Epidural hematoma. Complete or partial loss of skin graft, skin and peri-abutment infection in percutaneous implant. Skin overgrowth, bone overgrowth, implant extrusion. So coming to the cochlear implant, this is very important topic. Separate questions come in the exam. See here, these are the cochlea with implant electrode. This is receiver, this is transmitter, this is sound processor. So cochlear implantation is considered in the patient with severe to profound hearing loss who are failing to gain sufficient benefit from appropriate and well-fitting hearing aid. They are first true bionic sensor organ. Bionic means artificial. They convert mechanical energy into the electrical impulses. In most pathology, hair cells are damaged, but ganglionic cells are intact. Cochlear implant electrically stimulate these ganglionic cells. There are 35,000 auditory nerve fibers normally, and 10,000 are required for speech recognition using cochlear implants. So, candidacy. So this is very important. This is a separate question in PG final year exams. A cochlear implant should be considered only for a person with severe to profound hearing loss who doesn't gain benefit from acoustic hearing aid. So a trial of hearing aids should be used for at least 3 months. Remember that this is very important. This is as an exam for at least 3 months before considering cochlear implant. So prior to the preparing the patient for the cochlear implant, we'll give a trial of appropriately. So remember this keyword: appropriately fitting hearing aid. Individually, hint a score of less than 50%, average PT of 70 decibel. This is important. These are as an exam. So remember this. Greater are ideal cochlear implant can be there. Means what do you mean by ideal cochlear implantation? They will get benefit from the cochlear implantation. So stimulates bilateral cochlear implant, simultaneous bilateral cochlear implant is recommended for children and for adults who are blind or who have other disabilities. So elderly patients perform well with cochlear implant, with similar speech perceptions and improvement in quality of life when compared to the younger recipient. Patient with far advanced autosclerosis, we have read in autosclerosis chapters also, are among the best performers. Remember this, are among the best performers, possibly due to the fact that autosclerosis process generally spares the sensory element of cochlea. In neurofibromatosis too, also cochlear implant can be an option if cochlear nerve is preserved. So assessment, how will assess the patient for cochlear implantation? So autological assessment, what we'll see, examinations of detecting active middle ear infections or cholesteatoma. Will detect that as infections around an implant may be associated with risk of meningitis. So will in medicine we have cause no harm, the principle. So we have to see that any infections or disease in the middle ear or mastoid must be eradicated prior to the infection. Hearing test, hint and CNC were testing early speech perception there. Radiological, what we'll do, we'll see. Radiological, CT scan, anatomy of the facial nerve and canal. ये important है. और फिर enlarged cochlear aqueduct. So आपको incus, body of the incus will direct towards the facial. So इससे facial nerve damage करने से आप बच जाओगे. Defect in cribriform area of the cochlea और फिर presence of round and oval window. MRI, morphology of the cochlea and semicircular canal, patency of the cochlear duct, status of the cochlear nerve, the defect of modulus, फिर CNS abnormalities, early detection of labyrinthis ossificans. ठीक है. Psychological देखिए, careful psychological counseling to ensure that the patient and parents are prepared for surgery, and post-operative rehabilitation is also considered to be an important aspects of pre-op assessment. Basic design of the cochlear implant. So see this. This is the external transmitter. You will remember this is implantable receiver stimulator. This is microphone battery. So and these are reference electrodes. These are intracochlear electrodes. So basic design of any cochlear implant: the external part, microphone, sound processor, and transmitter coil. The internal receiver stimulation package, the intracochlear electrode. The external part, the part of the cochlear implant detects the acoustic signal and converts it into the electrical signals with both temporal and spatial components. Signal is transmitted to the internal device using radio frequency via the external coil. So this is magnet, this is coil, this is cable, display, and this is sound processing unit, indicator light, ear hook, BTE controller with 3 zinc air batteries, accessories connection. This is so. So internal receiver stimulator package, we'll discuss this. This is magnet, and this is antenna, this is 22 electrode, this is ball electrode, this is receiver stimulator. So contain the internal magnet, telemetry coil, and hermetically seated electronic system. Once received signal is sent to the electrodes within the cochlea. Latest generation of the cochlear implant devices are all compatible with the MRI scanning up to 1.5 Tesla. This can be asked in exams. Medals. So medical electronic cochlear implant have rotating magnet that self-align when in MRI fields, allows MRI scans up to 3 Tesla. So coming to the intracochlear electrode, These electrodes are placed in the cochlea. They can be inserted via the round window or through a small cochleostomy with a diameter of 0.5 to 0.8 millimeters. So, resting position of the electrode within the scala tympani, lateral wall, mid scala or modular hugging designs. So, length of the electrode, longer electrode allow for stimulations of the full length of the spinal ganglion, but also cause trauma to the apical basement. Anyway, so this is oval window, this is round window, electrode we have inserted. This is apex, this is scala vestibuli, this is spinal ganglion, this is organ of the body, bipolar cortex, or now. So, now, so surgical techniques. So mainly via transmasted approach, accessing cochlea via facial nerve. Other technique, varia technique, incus buttress approach, suprameatal, transmeatal, transaditors. Varia technique. This is non-mastectomy technique and oral route. Transcanal tunnel drilled in posterior canal wall helps in faster hearing, minimizing the trauma to the facial nerve. Surgery can be performed in infants who haven't yet developed mastoid completely. So complications, early complications, infections, wound adhesions, CSF leak, early device failure, balance disturbance, meningitis. Late can be pain, displacement, late device failure, otitis media, meningitis, extrusion of the device. So what are the vestibular symptoms the patient will experience? So approximately 30% of the adult implant recipients shows vestibular symptoms in the form of vertigo, dizziness, imbalance, benign paroxysmal position vertigo with positive DHP, DXL. The facial nerve weakness. Immediate post-op facial nerve is due to damage to facial nerve from direct trauma or by thermal injury. Tip fold over. Electrode tip may fold over upon itself, usually detected on post-operative image. Auditory brainstem implantation, designed to stimulate the cochlear nucleus complex in the brainstem directly by placing the implant in the lateral recess of the fourth ventricle. Indication: NF2 during second sonoma removal, post meningitis ossificans, traumatic auditory nerve avulsions, prelingually deep child with severe inner ear malformations, cochlear nerve aplasia, advanced otosclerosis. So hope I have done the full justice to the chapter. Will come with the more topics in the future. Till then, happy reading.